One of the goals of the Emily Foundation is to help create a treatment facility in Utah, specifically for new moms, with a warm environment, more like a maternity room rather than a psychiatric ward, where mothers will not be separated from their babies. Joining me here this morning is Eric Dykes and Amy Rose White, the director of the Utah Maternal Health Collaborative. Thank you both for being here. And let me say, our hearts go to you.
I appreciate that.
And your family. How difficult is it to watch your story?
It's difficult. I was left on February 24th, a widower and 5 young children, and it's hard to see our family without Emily next to us. She was there, and she was a big part of the family, so it is hard to watch that.
Part of you being here and being in that report is to help other people, and we'll talk a little bit about ways to do that. But as you look back at your relationship through this time, it was very difficult to understand your wife's mood disorders, wasn't it?
Yeah, she and I have known each other our whole lives, and I hadn't experienced anything like this prior. And we'd had 4 children, and she'd experienced a little bit of baby blues. But when I returned home with her with this 5th child, it was different. I could sense a difference in her, this heightened sensitivity, and just her logic was not what it once was, and she was very agitated for certain things. And so I was surprised, and I actually shipped the kids off to grandma's for a weekend to think things had settled down, and unfortunately it didn't.
Well, you were an LDS bishop at the time. You're a guy, you fix things.
Yeah.
That's what you do. How hard was it to not be able to wrap your arms around this and fix it, and what can the rest of us learn from that?
Yeah, that's exactly right. I was looking for the magic pill. I was waiting for somebody to say, take this and everything is back to normal. I was also waiting for someone through the process to grab my hand and step me through the process. We had great clinicians. Just from step to step, the coordination was not great. So I would suggest educate yourself. And even before that, anticipate what could potentially happen. If you're expecting or planning to have children, talk about what potentially could happen, educate yourself, communicate with each other, and then have resources at the ready, because the numbers are pretty high that something may come about.
Amy Rose, there's no magic pill. So what can families do as these come upon them?
Well, the good news is, although there's not a magic pill, and women are at highest risk of having an emotional health complication around the time of pregnancy and childbirth, women actually respond to treatment better at this time than other times during our lifespan. So prevention is really important, and one of the beauties of what Eric and his family are doing is providing our community with more awareness so that women are knowledgeable beforehand during pregnancy, of more aware of perhaps how they feel, talking about it with their care providers, and there actually are preventative steps we can take, whether that's guarding sleep, increasing nutrition, beginning therapy during pregnancy, sometimes medication, but often just understanding what all these illnesses look like, because we're actually talking about more than postpartum depression, which typically has more of an anxious component anyway. Then women can have a whole list of A, B, and C. I actually call it wellness planning. And you can do wellness planning during pregnancy and have a wellness plan for postpartum as well.
I guess the big question is, hindsight shows us all the things we could have done differently. But moving forward in this state, how do we know where to go to get the right treatment?
Well, that's the million-dollar question, and the Utah Maternal Mental Health Collaborative is working closely with IHC, the University of Utah, other systems in place, and we're hoping that as a result of increased awareness because of the Emily effect, that larger stakeholders, perhaps even at the legislative level, will work with us to find funding for a project where we can better educate the pool of mental health providers that we have, make sure that every OBGYN and midwife in the state knows what these look like, and have some way of routinely screening women so we catch them early on. That's not difficult to do. It's not terribly expensive, but there's always a dollar figure attached to making some of these changes.
And Eric, what can we look for as a young couple comes home from the hospital with a baby? From your experience, what should they look for from each other as some warning signs?
Well, I guess I'd start off answering that by, I read an article the other day that compared it to the candy in the candy wrapper. And as soon as the baby comes, the candy, then the wrapper's left aside. And in many cultures, they do better at taking care of moms. So I would say focus on the mom. when you have a new baby, everybody want to ask about the baby. Ask about mom. Ask how mom is doing. In terms of warning signs, I would suggest caregivers ask regularly. And don't be alarmed if the mom suggests something that may be a bit fearful. Emily and I had a very transparent relationship, and so she shared fearful thoughts with me, intrusive thoughts. And at times, I was scared. I was scared. I didn't know what to do with those. But we talked through those, and then the key is to get the right professionals involved, as Amy Rose has suggested, early on, so they can step you through the process.
How's your family doing?
Our family's doing exceptionally well. We have come together. Our extended family has helped us. We have a nanny now that helps out with the kids. Our kids are relatively well adjusted, and that's due to Emily. She was a fantastic mom. And now I'm reaping the benefits of her work that she did within our home. So we're doing the best we can. There's hard days, there's difficult days. We're still grieving, but we have a big support group around us.
And her legacy lives on, and we commend both of you for your efforts. Thank you for being here. Here again, a list of places where you can turn for help. Eric and Amy Rose, again, thank you for being with us this morning. Best wishes as you move forward, raising awareness and helping mothers and fathers and families.